If heart health isn't challenging enough, there are several serious side effects for cancer patients to be aware of. According to breastcancer.org, common cancer-related threats to the heart include chemotherapy, radiation therapy, some hormonal therapies, and some targeted therapies. Your doctor may test your heart before you start treatment for breast cancer and several times while you're having treatment. Dr. Nitza Alvarez, cardiologist at Tri-County Heart Institute, explains that if you are having chest pain or trouble breathing during breast cancer treatment, it's important to talk to your doctor right away to figure out exactly what's happening.
If you are a cancer patient, one of the things that your oncologist is going to want to discuss with you is the alternative therapy that are available for you. Some of the drugs that are used to treat cancer can be toxic to your heart. They can cause a weakening of the heart muscle, and it can translate into congestive heart failure. Some of those drugs are still used for management of cancer. Your provider will advise you and will let you know. However, if you haven't heard that any of the chemotherapy that you've been using can cause any cardiac problem, but you've been feeling more short of breath, or you notice that you're retaining water, or the ability of performing your regular activities are jeopardized by shortness of breath, you probably want to discuss with your provider. They might want to obtain an ultrasound of your heart perhaps, or a MOGA scan, some type of evaluation of the ability of that heart from pumping blood. The heart is a pump, and if this drug is affecting your heart, it's going to impair the ability of your heart to work. It's going to get weak. So patients can develop cardiomyopathy, congestive heart failure, related to the drug that they're using. More often than not, locally, eliminating the toxin from the system will help that heart recover. So that's the beauty of it. Eliminating the drug will help the heart recover. Once the drug is removed from your system, the opportunity of the heart function recovering is very high, but some patients might not recover their heart functionality back to normal. If you're ever exposed to any of those drugs that harm the ability of your heart from pumping, and you develop cardiomyopathy or congestive heart failure, you should never be exposed to that drug again. That a second exposure will be very detrimental to your health because it will kill more cardiac cells, making the ability of the heart pump much harder. So know what drugs are you taking and discuss with your doctor what are the possible side effects.
Breastcancer.org suggests some tips to stay heart healthy during cancer treatments. Manage high blood pressure if you've been diagnosed with it. Stop smoking. Exercise. Regular exercise can help maintain a healthy weight, reduce stress, and keep your heart and muscle fit. Relax. Use relaxation techniques such as meditation and visualization to help reduce stress levels. Manage your cholesterol levels. Lower your bad cholesterol, low-density lipoproteins, and raise your good cholesterol, high-density lipoproteins. Eat a healthy diet full of fruits, vegetables, whole grains, and low-fat dairy products. Reduce the amount of fatty meat and sugar you eat. Maintain a healthy weight. If you're overweight, your heart has to work harder. Excess weight also raises your risk of high blood pressure, diabetes, and high cholesterol, all of which can harm your heart. Join Dr. Alvarez every second Saturday of the month for Walk with a Doc. Participants will enjoy a brief presentation on important health topics, followed by a walk at your own pace track led by Dr. Alvarez. You'll find information on Walk with a Doc and the Tri-County Heart Institute when you click the Heart, Health, and Cancer Story link icon online at yourhometownhealth.com.